Hi, I'm Wallace Long, and welcome to the Health Practice Insights podcast, the podcast that brings you the business knowledge that matters most. Join us for insightful interviews with leading experts as health practice owners discover fresh perspectives, the latest insights, and growth strategies for their practice. In 2024, separate health sector research by the CommBank and RACGP highlighted the main challenges faced by health practice owners: increasing business costs, business profitability, sourcing and retaining health professional and support staff, growing and maintaining patient numbers, and keeping up with new technology. In this podcast, I'll be speaking with leading experts in the fields of finance, law, technology, human resources, and marketing. I'll be reaching out to health associations to gain their perspective and look forward to speaking with health business owners to hear their approach to tackling these challenges in their businesses. The Health Practice Insights podcast is brought to you by C2M Consulting, marketing advisors to the health sector.
In order to deliver that to potential employees and also to existing employees, your services have to be priced at a point that allow there to be enough income coming into the practice to spend the money on becoming an employer of choice and leaving sufficient funds at the end of the day for the profitability of the practice.
Welcome to this episode of Health Practice Insights. Shortly I'll be joined by my guest, business advisor Philip Arnfield. Philip will be sharing his health sector experience and insights into pricing, profitability, customer segmentation, becoming an employer of choice, and advisory boards. Philip ran a successful chartered accounting practice for over 30 years. After selling his business, Philip created and delivers his How to Build a Better Business training program to accounting firms and small business owners across Australia. Philip has worked with state business chambers, presented at national business conferences, and has been a mentor in the CA Catalyst program, a community initiative by Chartered Accountants Australia and New Zealand. Whether you're a sole trader, small or medium-sized practice, this episode is a must-listen. Now, just before I welcome Philip, I need to let you know this podcast is for informational purposes only, and the views expressed are those of the hosts and guests and do not constitute professional advice, and we make no representations or warranties regarding the accuracy, completeness or applicability of the content, and you should consult your professional advisors for specific advice relating to your situation. Philip, welcome to Health Practice Insights.
Thanks, Wallace. Happy to be here.
Great to have you on board. Now, Philip, may I start by asking you what you're seeing are the main challenges business owners across Australia are currently facing?
It's a common thread, certainly with the clients I work with and speaking with other advisors that work in the same space that I do. Number one, clearly, is attracting and retaining quality people. It's in my time in practice and in advisory, it's never been more of a problem than it is right now and for the last few years, since COVID, really. That's number one. We've had in the last few years, for the first time in maybe a decade or so, a significant increase in costs. So the inputs to business are now more expensive. It's driven by inflation, driven by scarcity. So business owners are finding it hard to attract good people, and the costs of running their operation are rising.
So how are businesses responding to these challenges across the board?
Well, some are not, and they're finding it quite difficult to keep their heads above water, particularly the increasing costs. They've just tried to absorb those costs themselves. The difficulty of getting people, because they have to pay more to get good people, is meaning that they can't deliver the same quality of service as the competitors that are doing the right thing, or their competitors that are doing the right thing. And the right thing to do when your costs are rising is to adjust your price. You've got to certainly look at your margin, which is the difference between what you sell a product or service for and the cost of the direct costs associated with that product or service. And if the costs are increasing, i.e. wages or other direct costs, you've got to increase your price. It's simple as that. Alternative to that is to let profit drain out of the business.
So there was recent research with health practice owners highlighted the main business challenges they're facing, which, similar to what you were saying, increasing business costs, business profitability, sourcing and retaining healthcare professionals and support staff, and growing and maintaining patient numbers. Are there any other business challenges that you're seeing in the health sector?
Well, I don't. I work with a number of clients in that sector. One of the things I don't see as being a problem is attracting customers, clients, participants, however you want to describe them. There's a lot of people out there requiring the services of health professionals. So I don't see that amongst the clients I'm working with that as being a problem. Getting quality people, professionals, to deliver the service is certainly a problem. And being squeezed in terms of price, and therefore their profits are being squeezed, is a problem. So, I mean, it's a pretty simple business. Is pretty simple. People think it's complicated, and sometimes accountants try and make it complicated, but it's as simple as this. There's a price you charge and receive for the service you deliver. There's a cost associated with delivering that service, and what's left is your profit. So pretty clearly, if costs increase, prices don't increase, profit has got to decrease. That's simple. It's a very, very simple equation.
So, Philip, most health practices will work with an accountant. You're a chartered accountant and specialist business advisor. What's the distinction between what accountants do and what you do?
Accountants are in the, some people say, enviable position of having a never-ending line of work, normally delivered to them by the government, in as much as every business owner has to lodge income tax returns, have to have various financial statements prepared, business activity statements need to be lodged monthly or quarterly. So accountants are in that space of helping their business owner clients comply with the taxation and business regulations. So that's really a core competency of accounting firms. And there's so much of that work around. Some are more than happy just to focus on that, just to deliver that service, which is a very important service to the business community. And they leave it at that. There are others that, like myself, who like to do more than just compliance, and that is deliver advice and help clients look forward. So what an accountant does in preparing those financial statements and tax returns, they summarise what's happened in the past, whereas a good business advisor is more focused on looking at what's happening in the future and say to the client, well, where does your business sit now in terms of the benefits that it's delivering you, the owner, and your family, the profitability and the lifestyle that's coming from that business, and are you satisfied with where that business sits at the moment? Is it something that you'd like to improve in terms of either growing the business or increasing the profitability? And that's what the business advisor should be working on with their client to say, well, how can we make this better if better is what the client wants to achieve?
You mentioned one of the key things that you're seeing, and the research indicated that health practices are struggling to attract the right people. The work that you do, what is the focus that you do that could assist them to attract the people that they want in their business?
Well, it's one of the things I do very early on in a client engagement is I challenge the client to say, well, let's overcome this problem that the whole industry that you're operating in is facing. And to do that, you need to become what we term an employer of choice. So that means that you create the circumstances within your practice, within your business, to say if an employee is looking to work in, whether it be as an occupational therapist, whether it be a dentist, a physiotherapist, any of the allied health professions, what about my business? What about the business that would make it the most attractive place for an employee to work? So you then have to say, well, what's the answer to that? And the answer is, I mean, there's lots of articles been written on this, but basically, the main things are that the employee has to be valued in the work environment that they're operating in. They need to be working in a good physical environment in terms of the space and the facilities and the equipment that they're working with. Professional development for any professional is important. the work that they're doing, the actual service they're delivering to the patient care needs to be enjoyable. It needs to be what the employee wants to do. We say money, or people say money's not an important thing. Well, it absolutely is. But money on its own won't attract someone to an organisation. It will be these other things that I've spoken about. And earnings is certainly up there. So when you put all of those things together, you've got to have good workspace, good equipment, good environment, professional development, enjoyable space, good earnings. That's expensive. So in order to deliver that to potential employees and also to existing employees, so they don't look over the fence and say, oh, that place looks like a nicer place to work, I think I'll go there. It comes back to your services have to be priced at a point that allow there to be enough income coming into the practice to spend the money on becoming an employer of choice and leaving sufficient funds at the end of the day for the profitability of the practice. Again, everything comes back to price. It's as simple as that. The price you charge for the services you deliver.
The costs of people is increasing, as you indicated. Costs of actually having a business have increased. What you're saying is that there are two things. One is that they can influence the price and also the actual profitability. How do they go about that?
It's interesting. People I have met and worked with in the health space always look upon themselves a little differently. I mean, I've worked across all industries, manufacturing, professional services, health services, pretty much everything. And the health professionals are, when I have this discussion with them about price, their hands go up in the air immediately. No, Philip, you don't understand. We're different when it comes to price. And with respect, I fully appreciate that the services that people are delivering in the health space is not just about profit. But then again, no business is just about profit, whether you're manufacturing, whether you're lawyers, whether you're engineers, whatever you're doing. If your focus is, if you're just about profit, well, you're going to go out of business because you're actually not delivering, you're not focusing on your customer. Coming back to the health professionals, they need, I think, assistance to understand the importance of price. So the sorts of arguments that I hear all of the time is, the health fund says that this is how much we have to charge, NDIS cap services. Now, I know NDIS do cap services, so we can't say to the government, well, you need to increase your price. There's a bigger discussion around that, which probably we don't have time to go into today. So let's just leave NDIS to one side. There's other things that a practice in that space would need to have a look at in terms of price, and that's segmentation of customers. NDIS aside, there's so much you can do with price to increase revenue. And it's not just a matter of saying, I'm going to increase my price 10% or 15%. You've got to segment the business into the services you deliver and the customers, the type of customers that you work with. What type of customers? I mean, there are customers that come in who are members of Health Fund A or Health Fund B or Health Fund C. They're all different types of customers. There are people presenting and their account is being funded by someone other than themselves. It might be work cover, it might be a government department, there are private patients attending. So, there's a wide variety of customers. The health practice has to look and segment their customers and then say, okay, are we seeing too many of the low value customers or the low paying customers, and can we do something about that while maintaining your professional dignity and your standards? You can, and this is an area that I work extensively in practice in actually doing that. It's interesting that I say that to clients, who controls the profitability of your business? And, they look at me and they say, well, I do. Or, I said, no. The person who controls the profitability of your business is the receptionist, the person who answers the telephone, because a customer rings and they get an appointment, next available appointment, or an appointment that suits them. Whereas we should be looking at the people who are ringing and saying, well, if there are a certain group of customers that are what I call discounted customers, so for whatever reason they're paying a lower price, then sure, we're not going to turn them away, but we're going to make sure that they don't take up all of the space in the diary so that we don't have enough space for higher paying customers. And sometimes as business owners, this applies to all business owners, we just allow the receptionist to fill our diaries with no regard whatsoever to what type of customers are coming through. And it hides a sales and marketing problem. Often people say, well, I don't have a sales issue because I've got a full customer list. I say, yes, you do, because you've only got a small group of customers who are at this level, and that's your sales and marketing problem that you've actually got to address. You've got to get more high-paying customers.
It's interesting, isn't it? Because that's a deep dive, and I wonder if many practices have in fact had a look at that deep dive.
People are coming to me, or clients are coming to me, and they don't do this deep dive, and they find it an empowering thing when I sit down and speak with them and talk to them about this, and also to support them in making this is not easy to do. They're very hard decisions to change your strategy around price and around the type of patients that you're seeing with an eye to profit.
In the next episode of Health Practice Insights, my guest is Cecilia White, HR consultant and director at Perks People Solutions. We'll be looking at the staffing challenges currently facing health practices and explore strategies that your practice can use to attract and retain staff. The key thing that I'm taking from you on this topic is the fact that they have control over this. They may feel as though they don't, but in fact they do have the ability to increase their profit.
Absolutely, they have control. Absolutely, they have control over. I mean, they're very intelligent people. They didn't get into the practice into the profession that they're in. They're smart people. What they don't have is support. And another thing that I do, and I think all good business advisors should do, and a lot of this doesn't happen. I don't see it happening in healthcare practices, particularly the small or medium-sized ones, is this concept, or the concept of an advisory board, where we know that big corporations have boards of directors and they meet every month, and every business should have an advisory board. And the advisory board quite often consists of two people, no more: the business owner and a mentor or a business coach, if you like, or in my situation, a chartered accountant who focuses on business advice. I sit down every month with a fixed agenda. I challenge the owner of the business. So, let's say we start off and the business is earning $130 or $140 or $80,000 or $560, depending on the size. So is this profit sufficient to do what we want to do in terms of outcomes for the owner, and also outcomes for the patients and outcomes for the employees, all the stakeholders in the business? Are we delivering at a level that is sustainable for this business? And the answer normally is no. So, okay, well, what are we going to do about it? Let's set a plan. Let's set a course of action. Let's challenge ourselves. And it will come back to pricing and productivity, that top line, that margin. And we have an advisory board where we talk about this every month. We review performance. We talk about actions going forward. And the business owner is challenged and supported in making very important decisions. And more often than not, it's something that has never happened to the owner of the business previously, and the impact of it is on the bottom line results and on the development of the business is enormous. If someone said to me, "What's the one piece of advice that you'd give to a business owner?" I would say is find yourself a good mentor, advisor, and appoint them as chair of your advisory board that meets monthly. Set day every month, second Tuesday of the month, 10 o'clock, 4 o'clock, whatever. Those meetings are never cancelled. They're board meetings.
So, Philip, do you have an example? You mentioned before about health funds and how they may restrict, or they have a limit in regards to what the reimbursement for a service may be. Have you got an example of how you've addressed that within a health practice?
Yeah, indeed. This particular practice was a preferred provider. It was a practice that the owners decided to invest money into the premises that they operated the business from, and in terms of the delivery of service to patients. It was a fabulous space. They employed very good practitioners and paid them an appropriate salary, and they were a busy, profitable practice. And I came in, I was actually invited in through an agency that there was a referral. They asked me to do a review of their practice, which I did. And I went back, I looked at 3 or 4 years, and rather than just look at the financial results or the tax returns, however, I jumped into their customer database. And I said, oh, this is interesting. 3 years ago, 30% of your patients came from this particular health fund, and it went up to 45%, and now it's gone up to 55%. And I said, yeah, we're a preferred provider. That's why that's increasing. And I said, well, this is not a good thing, because percentage of your patients that are coming in are paying a lower price. So the margin was dropping. So we talked about this and over 3 or 4 months, 3 or 4 different advisory boards, and we came to the realization that we had to do something about this, that we had to move away from this discounted price. And there was a risk associated with that the owners thought that they'd lose a good swag of their patients. And I said, well, why do you think the patients are coming here? Are they coming here because you're cheap, or are they coming here because of the expertise of the practitioners in the practice? Are they coming here because of the physical environment, which was a stunning place? Are they coming here because of the facilities that they can use to help with their rehab? You're sort of probably getting an idea of what practice it may have been. But so we moved away from being the preferred provider, and prices immediately went up, because we weren't offering the discount, and we didn't miss a beat. Well, we probably lost some customers, but it was not noticeable. The business had an immediate increase in profitability and is still going well. So, that's an example where people took a very courageous but appropriate decision, because at the end of the day, if this might sound strange, but if you're not charging your patients enough, you're doing them a disservice. And the reason I say that is because, we're here, whatever business we're in, but particularly in health, you're here to provide an outcome for the patient, for them to be better, for them to be healthier, for them to have a solution delivered to the problems that they're facing. And the way you do that is to deliver the best care. And the only way I think you can deliver the best care is to have the best practitioners delivering that care in an environment that is conducive to them staying and for the patient to be better. So that requires a certain price to be charged in order for that business to be profitable. And if the business is not profitable, you will not be able to retain the best providers, and your physical environment will diminish. It must.
Yeah, well, I'd imagine any business, because it's very clear that fixed costs that are going up. We've got increased costs for staff, and that's certainly going up. So there are two things which you've just got to pay for.
Indeed. The alternative is and this is happening sadly, is for the proprietor to say, oh, okay, well, I'll work longer. I'll work 50 hours a week for less pay. Well, again, I think you're doing your patient a disservice, because your longevity in the industry is limited. You're also doing, I think you're doing your family a disservice, because, why should the proprietor be the one that carries the can? It's just ridiculous.
I like the idea of the advisory board. I think and the regular contact that you'd have talking about working on the business and getting insights in regards to how you're going to increase profit over time in a strategic and considered way. Just on that example you gave, did you do any checks and balances before you made the decision to remove that health fund?
We did, yeah. There's a lot of work. We asked our patients how they would react if we'd ceased being a preferred provider for this particular health fund, which means that you would pay more for your visits. So we asked a good swag of our customers. Now, if 100% of the customers came back and said, well, good luck, you won't see me again, well, that would have perhaps made the decision harder. But we found that the response we got from our patient base was the significant reason as to why we were able to make it. Now, we didn't just ask them a question, if we charge you more, you're still going to love us. It was a questionnaire where, we're asking patients to comment on other aspects of the business, and it was clear. It was clear that they rated us highly across a range of criteria. And when we looked at that evidence, we thought, well, wow. I mean, they're not here because we're offering them a lower service. They're here for a whole lot of other reasons. So, it's the old, what do people buy? I mean, I say this across all industries when I'm encouraging clients to look at price increases or segment their customers and see more of the higher paying customers. People buy results. They buy good feelings, solutions to problems, hope, a vision of the future. These are the things. This is why people spend money. It's not. And therefore, once you understand and embrace that, decision around pricing and segmentation of customers is a lot easier.
In the context of what you do, I take three words: price, productivity, and profit, or profitability. Talk to me about how you work to increase productivity within a health practice.
I mean, this is always a difficult one. Can I answer that in a roundabout sort of way to start with by looking at non-health practices? So most businesses that provide a service other than in health provide a service together with a product. A plumber. Sometimes a plumber will just come along and provide a service of fixing a dripping tap or something, but they'll also install a hot water system or a new bathroom suite. Electricians are the same manufacturer. So if you're motor mechanics, so when they deliver a service, they're selling a product, and the product they buy from a wholesaler and mark up. For every hour that they deliver a service, they're making whatever their hourly rate is, plus a profit margin on materials. So when I look at the productivity of a business like that, I say, well, the more customers that we can see, the more services we're delivering, but also the more products that we're selling. So that productivity in that sense is very important because you get a double whammy. In the health sector, you don't have a product. You're delivering a service, so there's no markup on anything else. If anything, you're giving stuff away, bandages and things like that. But so productivity is important. Productivity is gross profit per hour that each practitioner is generating. And that is a key metric in any business that I work with. Is we say, well, what's the gross profit per hour? So in health, it's the difference between what you're charging customers and what you're paying the practitioner to deliver that service. And if you're delivering the service yourself as a proprietor of the business, you have to factor in a wage for yourself in calculating that. So there's the difference between the service fee you receive and the price you pay is your gross profit. Out of gross profit, we pay all our practice overheads, and what's left is net profit. So there's a certain level of gross profit that we target on a weekly basis, and that's driven by the number of hours that we're delivering to patients. And a business owner has to monitor that. If you look at all the practice software that's around, that does allow you, if you're using that particular module of the software, to actually look at that key metric of gross profit per hour, and the productivity therefore is how many patients are we seeing on a daily basis. So we've got to be careful. It's not a production line. Let's assume that we're not in the production line. So you've got to look at the level of gross profit that's being delivered on a daily basis, and that then comes back to really it's about the segmentation, because the patient will take the time that the patient will take in order for you to deliver the service, and some will take longer than others. We talked about segmentation earlier. You've got to make sure that you're seeing enough of the higher paying customers in a week to ensure that your gross profit, or the gross profit per hour, is at the level that it needs to be. So it's hard. I mean, you can't make people. I mean, I think people work, productively in the health sector. You can't make them work harder or faster. So productivity is important. It's important but it's probably not as important in the health sector, because people are there delivering the service that they think is appropriate. It's more about price, Wallace, and customer segmentation.
Yes, yeah, I'm hearing that. It's interesting because I've just got the GP Insights report in front of me from 2024. Some of the top priorities are to expand the range of services offered by GPs and to expand the range of services offered by other practitioners. So in a way, what they're doing is, one would suggest, is to actually utilise that human resource and make sure that they have other services that they can deliver, either at a higher value or at some way they're actually diversifying the type of work that individual people would do because they're limited in regards to the staff that they can attract.
Correct. So again, you've got to plan what profit you require and what does that mean in terms of the patients and the services that you're going to provide. Now, the thing, Wallace, it's important. You don't let the patients control the practice. The practice has to work out, and it's a pretty simple formula. You sit down with any accountant can say, well, this is how many appointments you have across the number of people that you've got working in the practice, the number of rooms that you've got. You've got this many appointments a week to generate this much revenue. We know what the costs are. They're fixed pretty much, and the profit falls out of the difference between those two. So there needs to be a lot of work, and you talked about productivity. This is the area of productivity, is how much revenue can I get out of the available appointments I have? And you have to set up a business model with that in mind, I believe. That's a very simple, easy conversation to have with a plumber or an electrician or a lawyer. You get more money from these sorts of customers. Let's see more of those sorts of customers. In the health sector, I'm not so comfortable having those discussions with the practitioners because there's a they say, well, we know we need to be here for everyone. Okay, I sort of get that. I do get that, not sort of I do get that. But don't let it control your life. Why? Like if you're a GP and that you'll make a call based on things other than profit in terms of whether you're going to bulk bill a patient or not. Sure, I 100% understand that. But don't let your receptionist fill your book with if you're going to bulk bill. You say, okay, well, with all those spots are full this week. We'll see you the week after next. That's how you do it.
Philip, that's been really insightful. Is there anything else in regards to the price, productivity or profit or anything else that you'd be suggesting at this point in time for health practices that would all be going through these challenges and having to address them? Is there anything you'd be recommending that they turn their attention to now?
Yeah, I've said it earlier in our discussion, Wallace. I think the most important thing they can do is go and find themselves someone to provide them this insight, to say, to be their advisor on a monthly basis, and it may well be the accountant that they're working with. It's maybe my accountant doesn't do that; they only do tax. Well, just ask actually, because often, accountants are talk about having difficulty attracting good people. Accounting industry is right up the top there in terms of a shortage of staff in accounting practice. So they're busy. So they might give you the impression that they don't do this sort of work, or it may be that they look at your practice and say, well, you can't really afford this type of work, or you wouldn't be interested in this type of work. I can tell you it'll pay for itself multiple times over. So ask your accountant, do you do business advisory work? Can you help? And if they say yes, say, good, I want you to work with me on a monthly basis, but make sure you ask this question: can you help me increase the profitability of my business? And if the accountant says yes, you then say, how? And if they can't answer that in a paragraph, say, thanks very much, love the way you're doing the tax returns, doing that, but go and find someone else. They've got to be able to answer in a paragraph how they're going to help you increase the profitability of your business. And the answer is, I'm going to help you segment your customers, make sure that your pricing strategies are correct, and we're going to set a profit target. That's how they do it.
Brilliant. Philip, thank you so much for your time. It's really insightful. Really appreciate you being part of the podcast and helping health practices grow.
Thanks, Wallace. Thanks for having me.
Big thanks to Philip Arnfield. I was struck by the practical nature of Philip's approach, focusing on pricing, building a great workplace, customer segmentation, and finally the suggestion to form an advisory board, even a simple one, stood out as a practical way to gain accountability, support, and strategic focus. I hope you found this episode useful as you navigate the challenges in your practice. To receive a PDF summary of this episode, head to the link in the show notes or go to our website, healthpracticeinsights.com.au. In the next episode of Health Practice Insights, My guest is Cecilia White, HR consultant and director at Perks People Solutions. We'll be looking at the staffing challenges currently facing health practices and explore strategies that your practice can use to attract and retain staff. Please follow us on Spotify or Apple Podcasts. Health Practice Insights is brought to you by C2M Consulting, marketing advisors to the health sector. I'm Wallace Long. Thanks for listening.